I'm Dr. Kahler. I'm the dental director here at Neighborhood Health Center. At home, it always starts with a cup of coffee.
Nice. Any particular roast?
No, I would say it's usually Colombian though.
Nice.
At home, my alarm's at 6. I start my clinical hours here at 8 o'clock. Cold, it tastes better. You really have to do, dentistry is a team sport. You rely on your team to make it happen, sure. My favorite part is probably the smile reveal. Like, for example, somebody who hasn't had teeth for 10 years and they've been wearing their mustaches long to hide their smile, and they're not smiling and they've become introverts. They don't leave the house, and to give them, say, a set of dentures that bring their smile back, that's a great appointment. We do root canals. Because we're a health center, most of our patient care falls under the Medicaid umbrella.
Mm-hmm.
And for the most part, Medicaid does not cover root canals on back teeth. And so through our sliding fee program, we're able to offer that service. Yeah, I would say probably death by chocolate ice cream, for sure.
Any brand specific?
No.
Any chocolate ice cream?
If it's dark and got a lot of goodies in it, that's all good. Let's take a tour.
Awesome.
This is our dental clinic here at Blasdell. We have 6 operatories. Kayla's in there cleaning someone's teeth right now. Hi, Kayla.
Awesome. So, obviously working as a dentist can be super stressful at times. What are some decompression techniques that you use?
Sure. There's Dr. Conboy. Say hello. And Nelson is our assistant.
Nice to meet you.
Decompression, I would say taking a nap, for sure.
That's a great answer.
Yeah.
So what's one piece of advice you give to someone who wants to work in public health? As a dentist or just in general?
Have a sense of humor, for sure. And be ready to be flexible, too. I had to become more extroverted. I was, an introvert, but, you have to engage patients. And so, every day you have to be on, you have to be talking to people, you have to be promoting dental health. And so, yeah, you have to become a people person. I've definitely grown, for sure. Yeah.
That's awesome.
It's real easy. It's someone who doesn't replace the toilet paper roll when they've used the last sheet. For the day, it'd be fun to be Dr. House. Okay, without the drug problem, of course.
Right.
But to be able to just look at somebody and diagnose them after talking to them for 5 minutes, and then basically not be PC to say exactly what's on your mind and not fear the repercussions. That might be fun for a day. Some of it's good if it's like from a reputable site like WebMD. It might help somebody who maybe wasn't paying attention in the doctor's visit to help them understand a little bit better. But social media, no. Stay away from the social media.
What's the craziest thing you've heard from social media?
Maybe we should try bleach to fix COVID. It would be probably reimbursement rates. Part of our patients in our community are having an access issue. We are inundated with a lot of patients that need dental services and they can't get it except from people like us. And a lot of that falls onto the reimbursement rates for people who fall under the Medicaid umbrella. is not high enough that a private practice, for example, will take on Medicaid. So people have difficulties finding access to care a lot of times. And so I think if the reimbursement rates were higher, I think more people would sign on for it, more doctors' offices and whatnot, and it would give greater access to patient care.
Services.
Right now we have open access if you are a new patient. Right now access is a little bit limited, so we have an afternoon per week where someone can call in the morning, and we have a set amount of appointments available for that new patient access. So it could be they would get an appointment within a week, quite possibly. So.
All right. Well, thank you so much, Dr. Kahler. We enjoy you answering all these questions for us. We enjoy being able to see a little bit of the dental section of Blasdell, and we hope to see you again soon.
My pleasure.
So, is there anything that we didn't cover or that I haven't asked that you'd like to share that people would be surprised to know about NHC, about you, about our services?
No, I think we did a pretty well-rounded interview there, and I would just like to say I very much enjoy working here. Love the environment, love the mission, and hope to continue.